So moving forward, so this is a presentation. This is a voyage through a series of questions and answers related with the clinics, basically with dermatology clinics. It is a freely interactive session, and I think it want to be a interactive session also. You want to interact through the chat, okay, or either directly you can interact. It's an interactive session for the beginners who can raise their queries. And I think there are so many senior doctors who have a great experience in treating dermatological cases. So there is also a discussion session with the senior doctors having experience and suggestions. And I have made this presentation as a blend of takeaway messages and creative questions to rethink about the concepts of Ayurveda. Means identifying the concepts of Ayurveda in the treatment of dermatology cases. Okay. So why this subject? So we are knowing that Ayurveda is not, everyone is thinking that it is not apt for emerging diseases, or more students are interested in teaching career than clinics. And we are having wider concepts instead of simple meaning. So the reasons are so many, but mainly our syllabus have a modern concept but are lacking the up-to-date knowledge, and we are having less research outlook in practice and study. So this is the introduction for this series. So case number 1. There are 7 cases in this presentation, and I have mixed it with some questions and some messages, takeaway messages that can be more forward. So this is the first case. It is a 62-year-old normogenic female patient. The patient is complaining with blackish skin lesions with severe itchings over the sole for lasting for 2 years. She was unable to walk due to the severe pain and was taking allopathic treatment for the last 1.5 years, and but only symptomatic relief was there. So this was the case, and it was during December 2018 that case was come to me. So this is the first message that I want to tell. Assessment of the patient. So we are moving forward with that. So assessment means an Ayurvedic assessment, mainly the assessment of Arogya of the patient. It is a patient, so there will be Roga, assessment of dosha of that patient, assessment of avastha of that patient, and assessment of Roga. You are knowing that assessment of Arogya, we are assessing, we are asking whether he is having good digestive capacity. Annabhilasho bhuktasya paribhaka sukhena cha. This is a slogan that should be kept into mind when we are assessing these factors, whether his digestion is okay, her digestive fire is okay, whether proper digestion was there, bowel is okay, bladder is okay, movement, bowel movement, urination is okay. Okay, all those factors should be considered. The acne should be considered while assessing the arogya. And for dosha, you can directly assess the tamuchwas and ishwa. There are so many slogas that is mentioned here and here. Basically, in skin disease, the second, Paithika skin is mainly associated with Pitta. So you should consider the Paithika association, also the other factors. No disease is mainly single dosha predominant. So we should consider these factors also. And the avastha, whether it is amavastha, niramavastha, or pachimana avastha. The avastha should be considered while considering a patient. And also the roga. You are knowing that Ayurvedic assessment, Dushya, Desha, Bala, Kala, everything. I'm not describing in detail, but considering the dermatological case, you should consider this also. From this day onwards, if you are diagnosing a case, you want to diagnose like this, whether it is a bulle, you are seeing that photo from this presentation. It is a circumference collection of fluid will be there, less than 1 centimeter. It is called a bulle. Then macule, you can see that photo. From that photo, it is identified, circular flat discoloration. Then nodule, circular elevated solid lesion greater than, sorry, less than 1 centimeter. Then patch, it is greater than 1 centimeter. Then patch, it is also a same, color is different. Okay. Papule, you can see. Plaque, pustule, a vesicle containing pus, it is called pustule. Bulla, it is a fluid filled lesion. Then vesicle, free fluid will be there inside that circular lesion. And second, wheel, you are knowing that edematous plaque, transitory plaque. Next, scale, there is epidermal thickening consisting of flakes or plates. Okay, crust, you can see from that photo. Dried serum or exudate over the skin, it is called crust. Then fissure, the cracking or splitting of skin, it is called fissure. Then excoriation, it is a linear erosion. Okay, it's called excoriation. Then lichenification, you can see the thickening of the epidermis. Okay, it is called lichenification. And last, scar, you are knowing that scar, you are having some scar over your skin, thickening or permanent fibrotic changes over the skin. So these are the different types of lesion. From this day onwards, if any skin cases or dermatological cases coming to your OPD, or IPD, you want to diagnose like there's a scale or a crest or a fissure is present. Okay, like that, you want to identify the lesion. That's the first case you want to consider. Okay, so this on examination, these are thick, hard lesions. You can see from the photo there is keratinization, keratotic changes is there. In keratinization and lichenification, the difference is that in keratinization, the keratin pigment, the keratinized pigment is more. We can't identify the skin margin, but in lichenification, the skin margin can be identified. Here, keratinized changes are there. There is no scaling and using crust with fissures. You can see fissures in this lesion. I will show that photo once again. There are fissures are there, cracks are there in that lesion. Keratinization is there, no oozing, no scaling. Okay. Sen, on examination, the bowel is constipated. She has a crura costa. She has a disturbed sleep. It is assessment of dosha. Disturbed arogya, disturbed sleep is there due to the severe pain of this lesion. She can't move with this leg due to the severe pain. Okay, she touches the ground, it will be problematic. Then interrogation revealed that she has a bad mindset. Okay, she was not good in this. So, what is your diagnosis according to Ayurvedic parameters? So, this is an interactive session, so you can send your answers to the chat box. So, what is the diagnosis? Vibhadika Kushta. Okay, Vikediba Kushta. Okay. Any other options? So, the diagnosis is Vibhadika. Okay. So, I will tell that answer also. It is present, you can see, Pani Padidaryo Vibhadika. Okay, Tivrarthi, Mandakandascha, Saraga, Pidigajida. Here you can see that lesion once again. Okay, here is the lesion. You can see in her foot also it is there. You can see her hand also. You can see in the pani, it is also present like this. These lesions are also present in her hand. It is present all in both her hands and both her legs. You can see from this photo itself. That's why I've taken like photo like this. Okay. And she is presenting with Tivrarthi. Manda Kandu. Kandu is not a problem. Itching is not a problem, but severity of pain is there. Okay. Tivrarthi, Manda Kandu, Saraga, Pidigajida. There are Pidagas. Okay. Pidagas which is here. That is not there. So the condition is Vibhadiga. So, okay, this is the second message. Importance of differential diagnosis. One person is telling that it is Kidiba. So, what are the differential diagnoses in this condition? The first one is Valmika. You can see it is a Shudra Roga. It is mentioned as a Shudra Roga with Grandhi with multiple openings. There is no opening here. Okay, that's the main reason for differentiating that it is not Valmika. Multiple openings present over the Padadala, Panidala, joints, and Jatruda region. But the other things are same. There is pain, burning sensation, itching, and oozing. Oozing is not there. Itching is not so predominant. Burning sensation is not there, and multiple openings are not there. That's why we are ruling out Valmiga. Pani Padadale Sando Jatro Chabajiyade Valmiga Vachanir Grandi. You are knowing that sloga. I'm not explaining it in detail. Next, Padadari, the second DD. It is also Ikshudra having cracks or fissures present over the pada caused due to the excessive walking. Okay, without chapels. Parikramana Shilasya. Vayu Atyartha Ruksha. It is due to the Rukshada of Vayu due to Parikramana Shila, excessive walking. It is having Padayo Kuride Darim Sarujam Tala Samsrida. It is simply the cracks or fissures. But here it is not the cracks, it is also keratinization is also there. So we can rule out that it is not Padadari. Next is Vicharchiga. Kushta associated with itching, excessive secretion from the piraga, which is shava in color. Okay. Here, okay, there is no secretion is there. Okay. Sakandu, Pidaga, Shava, Lesighatia, Vicharchiga. The secretion of Lesiga is not there. Not Kandu is not there. Hence why it can be ruled out. Alasa. Okay, Kshudra Roga, which is associated with oozing and itching present in between the fingers of the leg. Here it is not the in between the fingers. Alasa can be correlated with tinea pedis, but it is not there. Okay. Dushta Kardama Samspar, it is due to the muddy clay. Contact with the muddy clay, it is happening. It is between the angulis, it is happening, and it is not Alasa. Last is Kadara, which is mostly similar to this. It is also a Kshudra Roga, but there is pointed grandhi in the form of Keela. Okay, due to excessive walking on places filled with Sharkara. It is also not Keelavad, hence it can be ruled out. It is not Kadara, and pain is not due to this. Kandaga Dibihi. There is no Kandaga present in this. Hence, we are ruling out. So, these are the different DD. And Kidiba, it is Vritta in shape. I will tell Kidiba. Kidiba is coming as a case also. So, we will discuss Kidiba in detail. So, we can roll out that this is not Kidiba. It is also having oozing secretions. So, from all these DDs, it is not Alasa, it is not Vicharchiga, it is not that Padadari, it is not Valmiga, and it is not Kadara. Hence, we are confirming that it is Vibhadiga. Okay, so we want to diagnose a case according to these conditions and these uh, considerations. Okay, that's the first thing I want to tell. Okay, this is the message that is important that we should consider this thing. Next is, what is your diagnosis according to modern parameters of the same case? You can answer in your chat box. I am making this session as an interactive session, so you want to answer whether it is true, good or bad, whether it is true or false, no problem. Anyone? Palmoplantar psoriasis. Okay, right answer. It is palmoplantar psoriasis. So whether there is a type of psoriasis like that, palmoplantar psoriasis. Anyone? Whether palmoplantar psoriasis is a type of psoriasis? The basic classification of psoriasis. Whether it is having palmoplantar as a basic classification of type of psoriasis. It is not on the classification, it's not on the basis of that basic type of psoriasis. It is based on the place it is confirmed as palmoplantar psoriasis. Why? Because this is psoriasis affecting the palms and the plantar region. You are seeing that photo. It is a palmoplantar psoriasis. It's a chronic variant of psoriasis characteristically affecting the skin of palms and soles. Okay, and it is featured with, here it is hyperkeratotic. We can diagnose confirmed as hyperkeratotic palmoplantar psoriasis. This is the final diagnosis. Okay. Hyperkeratotic palmoplantar psoriasis. It is not a pustular type. The final diagnosis, hyperkeratotic palmoplantar psoriasis. In Ayurveda, we can diagnose it as Vibhadina. Okay, this is a lesion, and here it is a severe lesion. It is not like this. The fissures, cracking, everything is very much severe. Okay, it is not. This is a normal picture. So, next, what are the treatment options in Ayurveda? What you will give in this condition, on this case? You can give your answers in your chat box. Any option? What you will give for this condition? So I will move forward. The best treatment option is, this is, you can see it is a hard thickened lesion. So the best option will be a Vada Kabaja condition. Okay, Jivandyadi Yamaga. Okay, it is also a Ruksha lesion. Okay, you can see from that picture, it is a very much Ruksha. So you want to apply Snigdha for this, for the Snigdha. And the condition should be Vada Kabaja. So the best option will be Aragudadi Kashayam or Gugludikta Kashayam. Okay. And you can give Vilvadi Guliga. And you can see she is having constipation. This is, she is having constipated bowel. And also it is a Vada predominant lesion also with a severe pain. Uh, this is a skin lesion. Pitta should be considered. So you can give Manibhadra labia rather than taking with Avipatti in this condition. And for external application, you can go for Rasatomadi leba or you can go for Jivandyadi Yamaga. Okay, this is a treatment option that can be given in this condition. Basically, we want to tell whichever the medicine that we want to give. Don't tell about the doshi condition. Doshi condition should be in your mind, and the medicine should be in your pen, in your hand. Okay, you want to write the medicine at once when you are seeing this lesion. That's the motto of this class. The treatment option should be in your brain or in your mind, and the medicine should be in your, yeah, Guluchedi can be given. That I am telling that a classical triad is there. If you are not knowing anything about skin disease, you can safely prefer Guluchedi Kashaya, Villuadi Guliga, and Avipati Churna for any case. Here, I think rather giving Avipati Churna in the initial condition, I think Lehia preparation is rather good. Okay. And this is a treatment option, and this is the treatment that I have given in this case. Okay, this away not aware. Radhikadi Kasha is not available, and at that time Panchatiktaga was available there. So I have added Panchatiktaga. Panchatikta, you are knowing it is the first two line of Gulu Tikta Kashaya. Okay, I will tell. So I am giving Kashaya after food. Okay, that's my style of writing. I am giving Kashaya after food 15 ml of Kashaya mixed with 60 ml of lukewarm water after food. Okay, and I am adding Manibhadra half teaspoon in the night. And I am giving Rasotamadi Leba for external application. Pilwadi Guliga 101 with lukewarm water. This is the treatment that I have given in the first stage. Yeah, Lehe has been given due to the Rukshada, and also it is a Vada predominant lesion also. Kaishara Gugulu can also be given, no problem. But here I am giving this lesion, this Guriga, that is available here at that time. Gugulu preparation should be given to patients with consideration of Pitta Prakriti. If she is having a hypersensitive nature, you should consider that condition also. And in second stage, I have changed Manibhadra Lehya. After that Rukshada is reduced, I have changed it to Avipati Churna. And this is the medicine that I have given in this case. I am not going for a Virajana in that case. I am just moving with this. And you can see, this is the first lesion. This is the application after the application of Rasotamadi Leba and those internal medication, the first stage. And after that, it has been reduced a little bit. And some of the lesions have been gone. The hardness have been reduced, and it is drying up. And almost all the lesions have been cured. Okay, it is clear all over. These are different photos that I am having, and this is the last. Yeah, you can also give cleansing with Varachurna. You can also give that treatment, no problem. These are the option that I am giving, that you can apply a Tripala washing can be applied there. But what happens is that it's a painful condition, and if you are having soaking with water, sometimes it can be, for external application, you should consider a second option also. Why? Because external application is a problematic condition in skin cases. Rather going with this is a severe lesion lasting for 1.5 years. So you want to consider that point also. Internal medication is a must in this treatment. It is based on the avastha that I am given. I am telling that it is a ruksha predominant nature, and when it is coming to me, and I am giving this medicine based because she is having constipation, she is having a bad mindset. Okay, she is very much worried about this lesion. She can't even wear the chapels. Okay, by having this. But after this, I am having this patient for again 1 year. No lesion was there. It is completely cured. Okay, I have this photo, last photo with this. Yeah, Patya is also important. I think we will discuss the Patya. The diet session is not dealt here. We will deal that in the next class. I think an exclusive session is there for the diet. It will be going strictly with diet. Here we are directly discussing on the case. Okay, Mahatiktakam 2. Yeah, you can also give, but Trivandlehya, the dose should be reduced. We should consider it. No problem, but you should consider I am giving Manibhadra 6 gram in the night. I'm not giving as much. Trivandlehya also you can give as 3 gram or 6 gram is 3 gram is enough. Trivandlehya. And she was not a patient who is coming directly to, not a patient who is having Ayurvedic medicine for all the time. Okay, she is coming for the first time for Ayurvedic treatment. So for those patients, you want to uh, check before giving medicines. Those who are resorted to Ayurvedic medicines are can be given in higher doses, no problem. Okay, so we can move forward. So this is the condition. This is the medicine that I am giving. So Panchadikta Kasha is having that Kaba Pitta nature. It is reducing the Kaba Pitta nature of the disease, and also that Manibhadra Lehi is acting on the Vadija component and external application Rasotama leva. It is having sulfur. Okay, Rasotama. All the Rasa drugs that we are using in skin disease are having sulfur, and sulfur is a skin-friendly medicine. That's important point. You can see in modern medicine also most of the medicines are having sulfur compounds. Reference of Manibhadra Lehi in Charagam. Charagam Kalpasthanam. Last chapter. I will send it into the group. I will send you all the reference. Why? Because it will take us so much time when we are referring all those things. That's why I'm not presenting it in this presentation. It is a large presentation having 300 slides. So can we move forward? Whether you're having any questions regarding this, I will ask. So what is the importance of the word Krura Koshta, Mrudu Koshta, and Madhyama Koshta? There is a question for you, a simple question, and its significance in prescription in this case. What is the cost of this patient? Krura. Why it is Krura? Why it is called Krura? Anyone? Okay, Krura, you are knowing that. Why it is called Krura? Constipated. Vadiga. Vadiga, then why it is Krura? Vadiga, it is okay. Vada is Krura. According to Costa, we can select medicine. Okay, it's good. I am asking why it is called Krura Costa. The Mrudu Madhyama, you are knowing. Mrudu is soft. Madhyama is middle, medium, or optimum. Why it is called Krura? Ruksha. Ruksha Guna of Vada. Okay, a little bit more. We are we are probing onto the basics because of Vada dosha. That will heart stools. That's the right answer. A little bit. The heart stool is right. A little bit. Ruksha. Okay. Ruksha, heart stools, all those this. I will tell. Okay. Krura means cruel. The word meaning is cruel itself, isn't it? So, like a king extracting maximum tax from the people, this costa absorbs maximum water content and secretes very less. You are knowing that large intestine is a part which is absorbing and secreting the water content in the stool. Okay, after the digestion process. Okay, and you are having the loop out there, and there is excretion is there, secretion is there, absorption of water is there into the body. Again, secretion into the body that is making that stool hard or soft. Or here, this intestine, okay, more absorption, less secretion. That's right. That's the right answer. So more absorption is there and less secretion is there, like a king, a cruel king who is extracting maximum tax from the people. This costa absorbs maximum water content and secretes very less, resulting in hard stool. Okay, the patient is getting having hard stool, and over taxation is cruel, isn't it? Like that, over taxation is cruel. Hence, it is called crura costa and can be given strong laxatives. And here we are doing like that. Okay, Trivardor Manipatulehia. Mridu means it is soft. It is minimum amount of water content is there. Okay, absorbs very minimum and secretes large amount, resulting in soft nature or loosey stools. Can be given Virechana, which even Kshira can be given as Virechana for those patients. and madhyama means optimum. The absorption and secretion will be between this krura and mrudu. So mild laxatives are enough, like avibhati or tribala is enough. You're getting? This is the point. And krura koshta, the vada predominancy was there also. So you want to give in the form of thaila, eranda thaila, or triguna thaila, hingu triguna thaila, or like that, or in the form of lehya. Manibhadra lehya or trivil lehya will be good. And mrudu koshta kshira itself or draksha juice will be enough, and Madhyama Koshta, Avibhati Churna, Renitrabala Churna is enough. So, nature of the bowel and food habit should also be considered while prescribing medicine to a patient. That's the concern that I want to give from this question. Okay, you are okay with this case? Whether it is interesting? So, we can move forward. So, next, case number 2. This is a 15-year-old normosthenic. You are knowing that normosthenic. I'm not explaining on those things. This is a case-based discussion. Reddish pink skin lesion with severe itching of the over the abdominal belly region for 1 month. Had taken allopathic medicines and symptoms reoccurred. This is the case. In Plama-Panda region, there is how to differentiate. In Palma-Panda region, there are normally keratinization is there with psoriasis also. Okay, parotid type will be there in Palma-Panda lesion. Eczema, there will be increase with this drying. We will be coming with eczema at that time. I will discuss. So this is lesion. Okay, you can see. What is the diagnosis? Ayurvedic diagnosis. Please chat on the chat box. Okay, on examination, I will tell also this thing. Case taking assessment of the Rogi. He is a Pitta Prakriti patient. Okay. History of sore throat was there. Gutted lesion, raindrop like lesion. You can see raindrop like lesion. Scaling present, candle grease sign positive. Now your diagnosis will be okay. I am asking the modern Ayurvedic diagnosis. Case 2. I am telling this case, na? Same case. This case 2. I'm not explaining any third case. It is the same case. Can see the raindrop like lesion. Okay. It is diagnosis correct. Sidma. Sidmam, Roksham, Bahi. It can be seen as Roksha in the appearance. Snigdam, Andar, Krishtam, Rajaha, Kirit. Okay, it is positive. The candle grease sign is positive here. There are scaly lesions. Scales are coming out. Slakshna Sparsham. You can see it is from the picture itself. We can see that it is Slakshna Sparsham. Okay. Soft touch and Shveda Tamram. Color it is somewhat white or copperish or pinkish. Daugdiga Pushpavat. Prayena cha Urdhakayasya. That is seen present over the abdominal region. Urdhakayasya. Okay. Yes, Itmam. So what is your diagnosis according to modern parameters? You can answer on a chat box. Get eight psoriasis. Yeah, psoriasis. Whether a little bit, get eight psoriasis. It's correct. Guttate psoriasis. Okay. So this is a message from this case. Knowledge of associated features of this disease is important in the treatment and diagnosis of this condition. What is the knowledge of anyone? Can you tell anything that is mentioned by me as an important feature of associated feature of this condition? Anyone have mentioned a associated feature of this case. That's why it is confirming that diagnosis, modern diagnosis especially. In the history, I have mentioned like that. Can you tell that associated feature? I have given the treatment like in the nature of that complex spot. Yeah, sore throat. That's the important thing. Okay, this is the thing. You are knowing the type of psoriasis, isn't it? There are plaque psoriasis is there, nail psoriasis, guttate psoriasis, inverse psoriasis. Nail psoriasis is not a main type. Plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, and erythrodermic psoriasis. You're knowing that 4% of the people are having this. There are so many treatments are there, options are there. It is mainly an immune-mediated disorder. And this is important. Plaque psoriasis is having the 80% of the cases. There are red, scaly, demarcated patches. You can see plaque psoriasis. The plaque is there, first thing. Reddy, demarcated, reddy, scaly patches with silvery sheen. It is called plaque psoriasis. The silvery sheen you can see. And scalp psoriasis present over the scalp. Okay, silver scales. You are seeing that photo. It is having 45 to 56% of the cases. Nail psoriasis in the fingernails or nails, and but guttate psoriasis, skin of arms, legs, torso, and then also any part of the body, 10%. And erythroderm, inverse psoriasis. It's an important thing present over. It is otherwise called flexor psoriasis, present in the armpits. Okay, and intimate parts, including the genitals. And erythrodermic. You can see erythrodermic redness, lobster-like redness spots. It is erythrodermic. And last, pustular. It is very rare, dangerous form. Pustules, we have mentioned that pustule lesion. It is similar to pustule. You can see the guttate psoriasis. It's like weathery. Okay. Okay. And then the discussion session, I'm mentioning that psoriasis. Okay. How many of you are testing the case, heart cardiology? How many of you are checking for cardiac checkup of a psoriatic patient? Anyone? How many of you are checking the status of cardiac history of the psoriatic patient? Why? Because psoriasis and obesity and cardiac mortality, okay, are having very much what do you call similarity, or there will be closely related. A psoriatic patient will be having mostly cardiac problem, and chances of cardiac MI is more. Myocardial MI is more in psoriatic patients. Okay, it's a study. No problem. So guttate psoriasis, it's a skin disease. Usually it follows an infection like streptococcal throat infection, especially. Okay. Strep throat, like streptococcal throat infection, most common in young adult. I'm mentioning the age of this patient. It is 18, 15, isn't it? The hallmark symptom is breaking out in small red scaly patches. It is red scaly patch. And you can see the round or teardrop shaped pink or red patches of skin. It is a typical feature of guttate. It is called guttate. The guttate lesion means round teardrop shaped pink or red patches, usually 2 millimeter, 10 millimeter wide. And drop, the patches comes from the Latin word drop. That's why it is called guttate. Okay, usually associated with immune response. Psoriasis itself is an immunological response, this immunologically mediated disease. And here also there is sore throat is more common in all these cases, and sometimes it will subside within 3 weeks. Okay, but in some cases it will lead to plaque psoriasis in future. So what are the treatment options? So you should know about these associated features of this case if we are considering a disease. Okay, even if it is a skin disease, there is a feature of cardiac mortality is there. You should consider that in your mind. Second thing, streptococcal infection. I'm telling that sore throat infection is associated with this. So you want to check that thing also. Guluchari, it's a good option. Next. It is a kapha pitta lesion, isn't it? Basically, it is a reddish lesion having pitta predominance, pitta recta predominance. So the best option will be Manjishtari, I think, rather than Guluchari. It's a reddish lesion. Okay, you can also, there is streptococcal infection is also there, history is there. So Vilvadi is option. Sudarshanam Guliga is also option here. And Krimikna Guliga is also an option. Krimikna Guliga. Why? Because Krimihara treatment should be there. And also Haridraganda and Rajanyadi Churna as an immunological mediator. Okay, you should also always give in this condition if the patient is having, this patient is having streptococcal throat infection. So as an immunomediator, you want to give Rajanyadi Churna or Haridraganda. It's a must in this case. Yeah, initially Guluchari. That these are the treatment options. Okay, we are having a discussion that I will tell. What is Karma Purusha? You will ask this thing. So these are the treatment options. So I will prefer Manjishtari in this case. That's why I'm telling. Yeah, you can also, but he is a Pitta Prakriti patient. Okay, immunological response is there. Aggravation is there. So kindly consider Kaishora Gugulu can be given. In the previous case, it can be given. No problem. But here, it should be given with consideration. I'm not against Kaishora Gugulu. I'm giving Kaishora Gugulu, but for a Pitta Prakriti, I'm not doing. Takradara can be given. But I am not giving all these things. This is the case. Okay, it is cured within 1 week. Okay, so this is the treatment that I am giving. Panchadiktan Kashaya is the option that I am giving. That because it is available. The best option is Manjishtari, I think, in this case. And I am giving Rajanyari Churnam, and I am explaining that for the immunological response, especially for that, as an immunomediator, I am giving Rajanyari Churna. And I am also giving this after food. Okay, half teaspoon with honey. And Sorset ointment is giving for external application in this case. Sorset ointment. It is for psoriasis. This ointment is marketed by Aushadhi. It's very good in these conditions, psoriatic condition. In the previous case also, I am applying this Sorset ointment in the later stage. It is very good. It is giving good results. Sora ointment is also good. So you're okay with this case? Vilwadi. Okay. I think there is a study in Aushadhi that is done in Vilwadi Kulika. They are making the bacterial, what we call, they are having a microbiological, what we call, they are doing a microbiological evaluation of Vilwadi. They are applying this Vilwadi, I think, as a fumigation to a bacterial lot. And yes, the wonderful result was there. Vilwadi is acting against almost all the bacteria, virus present there. Not virus, bacteria, basically bacteria and fungi. So it is a very good antifungal, antibacterial drug. Rather than just this, what we are saying, it is basically an antimicrobial drug. According to me, I am using Vilwadi as an antimicrobial drug itself. And antifungal and antibacterial studies are proving that. Antiviral study is not yet done in Vilwadi. So we can move forward. Why? Because in the initial stage of, I am practicing this for 6 or 7 years. In the initial stage of my practice, I used to prefer Kashaya before food. But most of the patients are complaining, especially I am having so many young patients, and most of the young patients are complaining about their bowel irritation and regurgitation like that. Especially the patients who are not in resort to Ayurvedic medicines and those who are taking Ayurveda for the first time. This boy is also a case like that. He is taking medicine for the first time from an Ayurvedic center. So on these cases, I used to prefer like this, and my one sir is there who is doing this, and sir is giving me confidence to do like that. And all these cases treated by that sir was very good. So I am preferring that samely in my practice also, and it is having good results. Well, no one is complaining about this regurgitation, bowel irritation like that. But there are some cases in which we want to give before food. Okay, especially muhur muhur in kasa. Dashamula kadatre I am giving as muhur muhur. Okay. Vilwadi we are normally giving with honey or with water or dolasi swarasa, basically. That virya should be neutralized. And without Dushi Vishari is not a good option according to my concern. It is also good in this condition, but rather than Vilwadi is a safe option in all those cases. I think I have no negative result with Vilwadi. That's why Vilwadi is my best option. But my answer is that if you are giving Vilwadi to a to a skin food poisoning case, okay, that's important point. When you are giving Vilwadi for a food poisoning case, and if poison is there, left there, Vilwadi will cause us vomiting. Severe. You should, if the patient is having vomiting and if you are giving Vilwadi Gudiga to that patient, patient will, the vomiting will increase. Because Vilwadi is having such a special character that it will eliminate all the toxins. So it will get out all the toxins from your body and the vomiting will be increased. That is one or two cases are there with me like that. So don't give in that condition. Avipatti can be given as a Nitya Viretina. The word itself, Avipatti. Vipat means problem. Avipatti means not problem, not causing any problem. That's the name itself indicating. I'm not telling about Avipatti Kara Churna, I'm telling about Avipatti Churna. We can give Avipatti Churna in almost all the cases, but for children, I used to prefer Ajanyadi in the case of Avipatti. Okay. So, okay, shall we move forward? Whether name of the disease is needed in Ayurvedic case sheets, especially in case number 2. Yes, sir. Why? Why? I think in Charga it is mentioned as not needed to write the disease name, isn't it? No, it's not needed. Okay. So I will tell. Then the name of disease is needed. Yes, Charaka opens and name is not necessary. Disease can be named according to dosha, according to that kala, according to avastha. Medical legal aspect. It's right. So I am asking accurate diagnosis with Ayurvedic terminology is must, mainly medical legal purpose. If you are going to the court, Supreme Court or any court, High Court, they will ask what is your diagnosis. And as Ayurvedic physicians, it is their duty to write in Ayurvedic name itself rather than writing in modern name. Okay, if you are not diagnosing either it is which dosha or which roga, tok roga you can write. Tok vigara you can write. Tok roga you can write. Sir, we can write dosha with roga. Yeah, I will tell. Medical legal purpose, medical leave purpose, export of medicines. If you are giving that medicine to a patient in Gulf region, you want to write the diagnosis. Research purpose, documentation purpose, it is needed, isn't it? And I think this is the answer for your question that is asked. There are two types of vyadi, isn't it? Samanija vyadi and Jnanatmaja vyadi. All the Samanija vyadis are mentioned in Nidanasthana. Okay. Nanatmaja Vyadis are caused by Vada, Pitta, and Kaba. Atmaja. Atma is Vada, Pitta, and Kaba. They are causing Nana type of Vikaras. A single dosha responsible for a group of diseases. Basically, Vada 80, Pitta 40, and Kaba 20. Okay, it is mentioned and Samanya Vyadis are diseases which are caused by Tridoshas together. The Samanya, the word meaning similarity. Jwara is having similarity in Jwalanam. Kasa is having similarity in Kasanam. Okay, Pandu is having similarity in Pandutvam. That's the similarity. Okay, Kushta is having similarity in Kushnatvam, the cracking or nature of the skin. So these diseases have similar characteristics and hence the name Samanija, which is explained in the Nidanasthana of Ashtanga Sangra or Ashtanga Hridaya or anything, any textbooks. And like we are naming it Vadika Pandu, Kabaja Pandu, Vadya Kasa, Paitya Kasa, Varana Shobha, all those things. Okay, a patient coming only with sign of itching over the body can be diagnosed as Kandu. That is mentioned as an anatmaja vyadi by in Kaba. by Ashtanga Sangra or any other textbooks. You can see whether it is explaining. And we can give Atrabala Churna or Villadi Gulika is enough for that case. It is not a big disease. If no systemic disease is there, like kidney is not involved, liver is not involved, pruritus is not there, severe pruritus is not there, then it is a simple disease you can treat according to this. So nomenclature of the disease as Jara Pandu is not necessary all the time. As we can diagnose as Kandu, Taha, Supti. Why? Because all these are mentioned as Vad Vyadi, name as Nanatmaja Vyadi in Sutrasthana of every textbook. Clear? And you know, there are Namaskar portal is there. You are knowing National Ayush Mobility and Standardized Terminology portal launched. Okay, there are different for Ayush terminology. This is a it is there available. You can get all these things, and these are the different things which is available there. Okay, can we move forward? Case number 3. A 53-year-old normocetic male patient, skin lesion present over the thigh region with severe itching for 1 month. Was taking allopathic treatment but having only symptomatic relief. What is this case? Whether you're getting, are you getting bored with this? Interactive is good. Interaction is good. So what is the diagnosis, Ayurvedic diagnosis? Vicharchika. Tinea. What is the Ayurvedic diagnosis? Circular scaly. You can see circular scaly erythromatous. Erythromata, the word meaning erythrema means red. There is a erythrema, red circular lesion, isn't it? Yes, Dadru. Okay, correct. This is presence of pruritus. Itching is there. Presence of vesicles are there. You can see small vesicles inside that. There is an erythematous scaly lesion. Peripherally spreading lesion. You can see it is peripherally spreading. Okay. So the diagnosis is Dadru. Dirka Pradana Durvavat Adasi Kusumachavi. This is similar to Adasi Kusumachavi. Ulsanna Mandala. Mandala means round. Ulsanna Mandala. You can see the mandala. It is somewhat raised from the that mandala. That erythematous lesion is raised from the nearby skin. Okay. Ulsanna Mandala Dadru Kandumat. It is having severe itching. Anushangani. Anushanga means spreading. It is spreading lesion. Clear? From that, we are diagnosing it as Dadru. Modern diagnosis. What is the modern diagnosis? Yes, tinea corpora. Tinea corporis. Okay. It is there. Small circular scaly erythromatous area. You can see this. This is also seen. Sometimes borders may contain vesicles or pustules. It is called ringworm of the body. Increase during hot and humid environment. Okay, may have diverse presentation. There are different types of presentations of tinea corporis. You can see. So what are the treatment options in this case? So this is the thing, as it is a Pitta Pradana, reddish lesion. You can go for Guluchadi or Manjishtadi, Krimigna Guliga or Bilwadi Guliga and Avibatti. Okay, I am giving this thing, Avibatti Churna, half teaspoon HS Visani. And applying Sorset ointment is also good. You can also apply 6C. One ointment is there, 6C is also good in this condition, Bilwadi Guliga. But the patient was not willing to take Gandhaga Rasayana is very good. I think Gandhaga Malahara is a very good option. Rather than Gandhaga Rasayana, Gandhaga Malahara ointment is there. It is very much good in this condition. Where Gandhaga Malahara is the best option in this case. It is not available with me at that time. That's why I'm giving Sorset ointment. Okay, Gandhaga Malahara is the best option here. Gandhaga Rasayana is also good. I am telling that all those contain sulfur. The patient was not willing to take Kashaya. Okay, so I'm not giving Kashaya, I'm giving these medicines. But after 1 week, he's telling that, okay, why not Avipattikara? Avipattikara is not having so much Pitta. It is also Pitta Shamana, but not in a large condition compared to Avipatti. Avipatti is a little bit having some Shodhana properties also. Gandhaka Lebam, it is also good. I'm telling about Gandhaka Malahara. It is in the form of ointment is available. Okay. In the second visit, the patient is telling that he will prepare kashaya. So I'm giving kashaya churna and I'm asking to make the kashaya like this: 1 spoon kashaya churna with 4 glass water. Same medicine continued, and this is the case. It is cured. I didn't know. Okay, clear. So the message is this: knowledge of other similar conditions. You are knowing this message, other similar conditions. Tinea pedis, there is tinea. Tinea is fungal infection. Tinea unguim is there. Tinea cruris is there. Tinea capitis is there. Tinea nigra is there. Tinea incognito is there. These conditions will be coming to your OPD. So whether you are dealing with this, you are knowing this. Yeah, I will tell. Tinea pedis. That forgot that question. I will tell. Tinea pedicellus alasa. Okay, fissuring, scaling, or maceration of the interdigital spaces, and otherwise called athlete's foot. Mainly pruritus, malodor, and stinging sensation. Mainly between fourth and fifth toes. Usually in persons having touch with water morely. In more cases, you can see, and this is called tinea pedis. In Ayurveda, it can be considered. There are three many types. You want to know about all these conditions, but due to the time schedule that we want to skip some more slides. That's why. So it is called Alasa. Okay. The best option is burn cure ointment. One ointment is there, burn cure ointment. It is having good results for me. And there is Murivenna instillation, not applying directly. Installation of a cloth is very good. Okay, Rasotamadi leba is good. But in severe oozing out conditions, external application should be not done. And you should go for Guluchadir Manjishtadi Kashaya. And also ask the patient to stay away from water. Clear? The sloga that I have mentioned in the previous slide itself, we are knowing that. Dushtakardama samsparshat. Then tinea angium. Okay. Thick, rough, yellow, opaque, and friable nails. Can you diagnose in Ayurveda what this is? Anyone? In the chat box. So in kids rainy season or a recurrent tinea infection is there, I will tell that. It is coming in the next slide. Kunaga or chippa? What is correct? It is Kunaga. Okay, ongomycosis. Okay, cannot be treated with topical mean. Krishna abhikhada rukshascha karashcha kunago naga. You can see same. It is blackish in color. Okay, ruksha and khara. It is called kunaga. It is not chippa. Chippa is affecting the nail bud. It is called chippa. It is not affecting the nail bud. Mainly it is on the naga. It is kunaga. Removal of the nail is a treatment, I think. Rather than doing all those things, Raswathamadileba and Murvana ointment can apply, but if it is gone, it cannot be recovered. Okay, you can remove the nail and you can give the amount of Gulucharika and Prabalabas. And this is the case that is dealing that most of the patients are having tinea cruris, acute lesions, more bright red. Okay, mainly seen on the genital region. We can call it as jock itch, more common in males, especially during Grishma Ritu and Varsha Ritu. Why? Because the clots are not dried up properly. Penisa scrotum are not affected. So what is this condition in Ayurveda? This is also Dadru. This is also a spreading type. Ulsanna Mandal. Okay. And we are having very good effective treatment. Gandhaka Malahara is the best option for this. 6E ointment is also good. Arogya Vardhani Vadi can be given. Tripala Chirna can be given for this with Guluchari Kashaya. If it is reddish in color, you want to go for Manjishtari. Are you properly getting it? Are you getting bored? Whether it is okay for you? I think 1 hour is over. Whether it is interesting, you can go for the rest of the cases. So tinea capitis. I think you are having some cases like this. Okay, over the scalp. It is called ringworm of scalp, more common in children. Okay, occurs more frequently in black females. Okay, there are different types: non-inflammatory, inflammatory, black dot, favus. I think I will share this slide in your group. In blackish Ruksha tinea infection, what can be given? The best choice will be Aragudadi Kashaya with Tribala Churna, according to my concern. Okay. So these are different types. So I'm not explaining due to the time schedule. Tinea capitis. Okay, you can explain. I will give the PPT. So it can be correlated with Arumshika. Kabale, Kleda Bahula, or normally using out type will be there. Pittasrik, Kabapitta lesion is there. Pitta recta lesion is there. Sleshma also there. Jandu Bihi, Kangu, Siddharthaganiba, Pidiga, Suhu, Arumshika. Okay, so for in this condition, rather than going for the external treatment, the best option is Panjishtari Kashaya. You want to go for internal treatment itself. Kapha Pitta Rekta Shamana Kashaya should be given. It is best is Manjishtari. Avibhati and Krimigna Gudika should be given here. Rather, Avibhati for going with Shamana, we want to go for a Virejana. That is a good thing here. Okay, then tinea barbe. You are knowing barbe stitches. I think the males are having some conditions in their life once in their life. Ringworm of the bird affects the hairs and follicles, effectively, of birds and moustiques. And usually, if it is happening during shaving from outside. Okay, tinea barbe. The same treatment for tinea capitis is advised in this condition also. Okay, barber's itch. Tinea nigra. You're seeing that nigra black color on your hands and legs. Okay, superficial infection of stratum corneum due to black yeast or tay. So for this also the same treatment is available, but you can change the kashaya to Aragudadi. Aragudadi, Avipatti, and Krimigna Guliga is the best option in this condition. And last, tinea versicolor. You are knowing this type of lesion also. Tinea versicolor, whitish skin lesions are present over your upper part of your region, basically. So this is called tinea versicolor. Fungus malassezii is responsible for this. Loss of skin pigmentation sometimes is there. Okay, here you can go for Guluchadi Kashaya. It is a whitish skin lesion is there basically. So Guluchadi, Trabala, Vilwadi. Or Krimigna is the best option. Tinea incognito. Incognito, the word meaning inappropriate assumption. No specific causes there. Okay. So my message is that you want to consider all these conditions while you are sitting in your OPD. So explain the importance of concept of Karma Purusha in Ayurveda with relation to the condition of the case 3 patient that I am telling that this patient is not able to take Kashaya in the first visit. So what is the concept of Karma Purusha? What related with this and who is Karma Purusha? What is the concept of Karma Purusha telling? We want to move a little bit faster, please. Patient. So what is the concept of Karma Purusha? Regarding clinics, I will tell because the time is not. Okay. So Karma Purusha is nothing other than the Rogi. He is Chigilsa Adhikrita Purusha, Adhisthana Purusha, Shraddhadu Purusha. So many names are given in the basics in the first year or second year of your BMS. He is nothing other than the patient. Patient is unable to prepare kasha in my case in the first visit. As he cannot afford while going for a job, he is having a job and is not having time to prepare that kasha in the morning. I am having only kashaya churna at that time. Versicolor in versicolor, I am getting good results with Gulichari rather than any other preparations. Aragodari can be given, but rather Gulichari is having good results for me. So, Chigilsa Adhikrita Purusha. Why is called Chigilsa Adhikrita? Is we are doing all the IP, IOP treatment, all the Rektamokshana, Panchakarma, anything in that patient. Hence, he is the Adhikrita of that Chigilsa, hence called Chigilsa Adhikrita Purusha. He is called Adhishtana Purusha. Why? Because we are doing all these treatment procedures on this patient, that Adhishtana. Hence, he is called Adhishtana Purusha. Yeah, Yukti, we should know. Yukti, I am telling that. Why? Because if I am having, I am giving this Manjishtadi, Guluchadi, mainly Guluchadi and Avipat, this Arogadadi to that patient, but I am not getting good results with Arogadadi. I am getting results with Gulichadi itself. I think rather than anything, I think Gulichadi is more effective in that case. But I am giving Tribala, not Avibhati, Tribala in that condition. Shaddadu Purusha, the patient itself, you are knowing that Shaddadu, the body, mind, along with the soul. We want to treat the soul of the patient. Okay. Considering the soul means we should consider the karmas. Or he is called Karma Purusha. Why? Because all the karmas, which I have mentioned. Okay. And that means we should consider the physical status, the body weight, the stature, the mental status, psychological state, the social status, the position, the family status, single, married, widowed, the economic status, whether he is poor or rich to buy the kashaya or the medicine, the emotional status, whether he is weak or strong, the vocational status, the job profile, the ecological background, the place in which he is living. We should consider all those factors while prescribing medicine to that patient. This is mentioning under the concept of karma purusha. I am dealing with that and I am giving medicines according to that. Why? Because that's why, because I am changing. It is a little bit kapha predominant condition, versicolor. That's why I am giving triple R. So it's okay. Shall we move forward? Case number 4. A 13-year-old normosenic male patient complained of reddish skin lesions with itching present over the pada for 1 month. Okay, this is the case. Simple case. Okay, I think you are getting this type of cases. It is a reddish, pink, scaly, dry lesion. You can see the fissure. Now you can diagnose or differentiate all those skin lesion. Crust is there, fissure is there, isn't it? That we have mentioned in the first slide. There are fissures seen, crust you can see, scales you can see, dry lesions is there, fissures is there, and bleeding present on cracking. So what is your diagnosis? We are moving a little bit fast now. Eczema. I am asking Ayurvedic diagnosis. We are Ayurvedic physicians. Our first diagnosis want to be in Ayurveda itself. Yes, Vichachika, right? Please mention that sloga. It's not from Ashtanga Hridaya. It's a little bit different sloga. Ruksha Vicharchika, right? That patient, that Dr. Grisha is right, giving the right answer. It is Ruksha Vicharchika. Rajyo Adhikandavarthi Rujaha Sa Ruksha Bhavandi Gatreshu Vicharchikayam. This is a quotation from Susruta Samhita Kushta Nidana. He is mentioning it as a condition of Ruksha Vicharchika. Rather than you are knowing that sloga of Ashtanga Hridaya, Sakandu Pedaga Shava Visa Lesikhatyo Vicharchika. It is having Lesika secretion. But here it is Rajyo. You can see Rajya means that lines. You can see lines over this lesion, isn't it? You can see lines over these lesions. You can see fissure, isn't it? Kandu, Adi Kandu, Ruja, Ruksha. It is Ruksha Vicharchika. Clear? There is no oozing. Bleeding is there when cracking. So it is Hiroksha Vicharchika, and this concept is given by my wife, Dr. Ashwati. She is giving me that explanation when she was studying, and I am practicing that. It is correctly mentioning in our classes. So it is nummular eczema. Modern, you are knowing that it is eczema. Type is nummular eczema. What is nummular eczema? It is coin-shaped lesion on arms, legs, torso, and on the hands with itching and burning. Lesions are oozing liquid and have crusted over. Okay, it is crusted over. Red, pinkish, brown, scaly, and inflamed lesions. This is a type of nummular eczema which is having crust and also fissures. So what are your treatment options? Anyone? What are your treatment options? Whether you're getting, whether you're getting this point, Prachanam. Okay, it's good. Any other option? He's a boy, 13-year-old. Can you move it speedily. I will tell. Treatment option is Padala Kaduranyadi, Guluchari, Nalpamaradi. Okay, good. I am giving with single medicine, simple medicine itself. Padala Kaduranyadi is also good, but I am treating with simple medicines only. Okay. Manjistad is can be given Cremigna, Villuadi, and Tripala. I am giving this medicine, Manjistadi Kashaya. As he is a boy, 5 ml Kashaya with 50 ml water. Tripala Churna as it is dry lesion. Okay. Sourcet ointment for external application. As it is not oozing. Okay, as it is not oozing, I am giving this external application. If it is an oozing type, eczema, don't give external application. Okay, Vilwadi Guliga, half with honey. And this is the photo after that. 2 weeks. It's cleared. Okay. Guluchari is also a nice option, but rather than eczema, considering eczema, Manjistadi should be preferred. And we can give also whitening like medicines. Nalpamiradi can be given now after this. It's not oozing. This case is not an oozing type. I am telling that it's not oozing. It is a crusty type. It is not oozing. It is only bleeding after over cracking. It is a Ruksha Vicharchika. I think I am explaining that in the previous slides itself. It is not an oozing type. Okay. Bleeding present on cracking only. Dry, scaly skin lesions with formation of fissures. That's why I'm confirming it as Ruksha Vicharchika by Susruta. Yeah, we can apply Gandhagaleva here. As it is not an oozing type, you can apply external application here. No problem. And for me, Vittu yeah, in initial stages we can give. Whether it is not oozing, then we can give. And after that, you want to give Nalpamaradi Kera or Venda Velichanna. Okay, virgin coconut oil for regaining the color of the skin. After getting the skin texture clean. Now it is clean, you can apply. Clear? So what is the importance of Rokshada and eczema with respect to the case for patient? I am explaining that. In Ashtanga, it is mentioned Sakandu, Pidaga, Shava, Lesigatia, Vicharjiga. In Susruta, it is mentioned Rajyo, Adi, Kandavarti. Okay. So Ruksha, Bhavandi, Gatreshu, Vicharjigayam. So this is a difference. Here, it is Rukshada type, mentioned as Ruksha, which is that dryness is an important factor in the manifestation of eczema and atopic dermatitis. It will aggravate. Dryness will aggravate. That's why in some season it is aggravating. So we want to give a little bit Snigdada for the treatment. Okay, in the form of medicine itself. So you want to consider that thing while treating eczema. You want to consider the main dosha here. The same case, another case is there, case number 5, 65-year-old normosenic male patient, skin lesion with itching and oozing present over the pada. The same. You can see here, it is severe itching is there and oozing is there. What is the diagnosis? This is two different cases of same Vicharchika. Okay. It is also Vicharchika. But here, Sakandu, Pidaga, Shava, Lesigatia, Vicharchika. Why Manjishtari, I will tell. From this case, you will realize that. It is having severe itching. Pidaga is not there, but Lesiga is there. Shavada is also there. Sravi Vicharchika. Yes. That's the diagnosis. Ravi Vicharchika. You are knowing. It is also nummular eczema, coin-shaped lesion, the same. Itching, burning, nosing, everything is same. Treatment option, it's different. What do you want to give here? You want to go for a oozing Shamana Kashaya, isn't it? Oozing Shamana, Kapapitta Shamana Kashaya, basically, and also oozing Shamana. A more predominant Kashaya should be given. I prefer Punarnavadi Kashaya for that, but rather adding with some other Kashaya also. Chandraprabha Guliga should be given here, or Sudarshana. Any inflammatory subsiding drugs should be given, added in this condition whenever it is oozing type. Okay, that's you want to consider. And I am giving Puluchadi but Punarnavadi Kashaya. Mix. I am mixing Guluchadi with Punarnavadi. Punarnavadi is giving Punarnava, Nimba, Paroleshundi, Tiktamba, Darvi, Abhaya, Kashaya. All these drugs are Pitta Shamana or Kapha Shamana. Whether Punarnavadi, all the drugs are Pitta Shamana or Kapha Shamana. Yes, Pitta Shamana. Do you know how we want to consider that? Vadadi Kunabha Grandhi Puya Kshina Malahoyam. You are knowing that. Vadadi Kunabha Grandhi. Vada, Pitta Khaba, Kunabha, it is for rectum. Regarding Arthodushti, it is mentioned. Puya. It is like that we want to consider Puya Kshina Malahayam. Puya is Pitta Kapam. So pus is there, Pitta Kapam is there, and predominant Pitta Kapha condition is there. So you want to go for a predominant Pitta Kapha drug formulation. It is Punarnavadi. Yeah. Mainly Pitta Kapha Shamana. Pitta should be, that's why oozing is present when there is oozing of Kaba. I will tell that concept. Kaba is a thing with you want to consider kaba like a cuff. Okay, cuff not cuff. Kaba was a sticky nature. Vada as a air, and pitta as lava. When lava is mixing with agni is mixing with this thick thing, it will be oozing out. It is kaba pitta. When this sticky is dried up with air, it will be hard. It is vada kaba. Okay, when that air and that water will be coming, it will be kshina. It will be dried up. It will be Vadapitta. The option will be Drakshadi like that. So here Guluchadi Punarnavad is the best option. And for subsiding the inflammation, Sudarshanam can be given or Chandraprabha. Chandraprabha is the best option, but it is not available at that time in my dispensary. That's why I'm giving Sudarshana. Okay. And after that oozing nature was given, was gone. Okay, I'm telling like that. Why? Because in the first stage, there is severe oozing, so external application is totally prohibited. Okay, and I am adding this Sorset ointment. And for subsiding that eczematic condition, I am also adding Aragodarishta and Amardarishta. Considering that the patient is not having problem with Arishta. And this is second stage and this is the last stage. It is gone. Kushnadi. Kushnadi work means cracking of the skin. The skin is cracked up and here the skin texture is completely normal. That you want to consider. Then after that, you want to regain the color of the skin. Clear? So from this, the message of this is avastha of the disease. You want to consider the avastha of the disease of the patient. Okay. And which avastha it is coming. It is Roksha avastha or it is Snigdha avastha, whether it is Hama avastha, Pachamana avastha or like that. Okay. So what is the importance of Shatkriya Gala in skin disease? It is mentioned in that, isn't it? You are knowing that Sanjayam, Pragobam, Prasaram, Sthana, Samsrayam. So this is Kriya Gala is one Kriya for one Kala. This Kriya should be done in this Kala. That is important. It is not the Kriya Kalas. One Kriya should be done in that Kala, concerned Kala itself. Kriya in Sthana, Samsraya should not be done in Chaya. And it is explained as dam concept. You are knowing that dam, isn't it? Means Sanchaya means increase in water level up to normal. It is Sanchaya. If it is having maximum capacity of 2000 liters, normal water level is 1750 and a little rises Sanchaya. When it is reaching maximum 2000, it is Pragoba. When it is reaching maximum height of the dam, it is oozing from the side, it is Prasara. And we are not doing anything, then it is going overflowing. and it will be affecting the houses in the nearby places. It is called Vyakti, and that person in that house should go away. If he is residing there, it will be problematic. Water will be reaching half of this his belly. It is Vyakti. And if it is not escaping, then it will cause flooding of that house, and that person's life is gone. It is called Beda. It is mentioned as damn concept of Ayurveda, isn't it? So Pancharma is not the treatment for all disease condition. We are doing like that. Rektamoksha is not the treatment for all the condition, but it should be done also. You are knowing this type of classification, Snehadi Sadhya and Shastradi Sadhya. It is mentioned by the surgeon Susruta. So you are knowing that in Yogi Sutri, I think it is mentioned like this. Snehadi Sadhya should be treated by Snehadi Karma itself. And Shastradi Sadhya, you can treat with Snehadi in the first stage. If it is not going, you can start Shastradi. You're getting this. You're knowing this type of classification. All the diseases are classified like this. Okay? Whether we can move forward? I think time is. Doctor, what we want to do? I think two more cases there. Whether we can move forward? I think it will take 5 minutes, 10 minutes more. Whether it is interesting? Okay, six. A 37-year-old hypersthenic male patient. Hypersthenic, okay. Blackish nodular skin lesions present over the skin of leg region with severe itching for 1 month. This is the case. What is your diagnosis? Scaly, circular itching lesions are there. Anyone? What is your diagnosis? Ayurvedic diagnosis? Time is not there. Please tell fastly. I will tell it is. It's not lichen planus. It's Kiriba. Lichenification is not there. Yet Shravi Vrittam. Khanam Ugra Gandu. Tat Snigdham Krishnam. Okay. Snigdha Krishnam Kidibam. It's from Susruda. Shravi is there. Somewhat dosing. Vritta round in shape. Khana hard. Ugra Gandu. Severe itching is there. The patient is coming to me for that itching. Snigdha Krishnam. It is Snigdha in nature. Krishna. Okay. It is prurigo nodularis. Prurigo nodularis. This is the condition. Okay, these are the DDs. You can tell lichen simplex chronic is also a DD. Lichen planus is not there. Lichen simplex. Hypertrophic lichen planus is also, but there is no hypertrophic lesion which is there. Not there. Okay, wedge shaped is not there. It is round shaped are there. It is prurigo nodularis. Hypertrophic LE is there. Lupus. These are different DDs. We can go for this. It is nodularis. These are the signs and symptoms. You can see the butterfly sign is there. Means it spares the upper mid back region. Okay. Intense itching of dome shaped nodules. That's an important feature. Dome shaped nodules are there. It's an important feature of this lesion. Also, what are the treatment options? Now you're having an idea. Black, round, thick lesions. What is your treatment option? Okay, Aragudadi, Tribala and Dushisha. I'm giving Aragudadi Kasha in this condition. Okay, Tribala. Tiktagam can be given, Guru Tiktagam can be given in this condition. But please listen that if it is a female patient aged between 18 to 48, 18 to 45, means reproductive age patient, don't go for Gugulu Diktaga. If she said, if that patient is a reproductive aged female patient between 15 to 45, don't go for Gugulu Dikta Kashaya, as we call that Gugulu Dikta Kashaya is given for elephants. Okay, in that elephant treatment centers. You are knowing that it is severe Kabashamana. and all the kabatvam or snigdhatvam of the female patients, reproductive age group females will be gone if you are giving Guguluktam Kashayam. And you want to give Guguluktam Kashayam only with Tribala. Why? Guguluktam Kashayam is having, you are knowing that cortical Tribala Guguluktam Kashayam is having some problem with regarding some Pitta Prakriti patients. They will have some irritation. What is happening that they are using that Balladaga and the antidote is, you are knowing. That's why Tribala Churna should be given as a Tribala Churna will be given with Guguluktam Kashayam. And my option is Aragodadi here. Why? Because Guguluktam is not available. Guguluktam can be given here, no problem. Tiktagam also can be given here. Okay, and external application, KK labum. It is Konnaila Kadugadi labum ointment is there. That thing is I am giving in the second stage. Why? Because in the first stage a little bit oozing is there. For any oozing lesion, I am not giving any external application. That's my treatment principle. And after that oozing was subsided with this medicine, I am adding Konnaila Kadugadi labum. And this is the thing. It is difficult to cure this pruricon nodularis normally. Okay. So doshic predominance of the skin disease want to be considered. Okay. So explain the importance of dosha assessment of skin lesion. Basically, if you are having a reddish oozing skin lesion, Rekta Pitta related, it should be Manjishtadi Kashayam want to be in your mind. If it is a blacky itching lesion, Aragadadi want to be on your mind. Blacky, itchy. Okay. I will give that in that group. Okay. Kondila Kadigadi. Then wide scaly lesions with pruritus, Guluchari can be your option. If it is a hard keratinized lesion, Gugulu Tiktagam can be your option. And Panchatiktagam Kashayam, it is very good for all the skin diseases, but try to use Panchatiktagam Kashaya by yourself. I am using Panchatiktagam Kashaya when I am going to my clinic. It is a severe tasteless Kashaya in my life that I have used. Okay, we can't afford Panchatiktagam Kashaya. And for young boys or girls who are coming for your OPD for the first time, don't give Panchatiktagam Kashaya. They will tell your clinic as your ghost clinic. Okay, that's my experience. Yeah, Google Gruda can be given. Gruda not so problematic, but Kashaya it's very severe. You should consider that condition. Okay. Last customer phase number 7, 55-year-old normosonic female patient itching over ankle region. This is the case. Okay. You can see. Can you see that this is a rough patchy like appearance? What is the diagnosis? Anyone? It is all Skidva, but it is from Ashtanga Hridaya. Roksham, Khinna, it is Roksha in nature, isn't it? Khinna Kharasparsham. You can see that feature. Khinna Kharasparsham. It is a roughy, patchy lesion. Okay, Kandumat Parishasidam. It is little bit Parisha. From here you can see. Okay. Diagnosis? Modern. It is lichen simplex chronicus. Okay. You can discolor leathery looking. Leathery looking. That's important feature. Leathery looking skin lesion. This is the thing. In Kerala, it will be like this, like black lesion. Okay. It's according to skin texture. This is the case. Okay, this is after treatment. The leather lesion is gone. So here, the Sotamadi Aragudarishta Punarnavasava has been given Tremignodi. So what is the importance of Sangramika Roga with special reference to skin patient? Please listen. You are treating Kushta. It's a Sangramika Roga, isn't it? Sankramanti Naran Naram. Nara means a person. Nara means another person. Naran Naram. Sankram. It is Kramatil. It is coming in an order from one person to one person, which is a transmissible disease. Prasangat Gatra Sparsha. You are knowing that sloga from Susruda. He is mentioning this sloga in the context of Kushta. Okay, Prasanga, you are knowing sexual contact, gonorrhea, Gatra Sparsha, leprosy, Nishwasa through breath, airborne, chickenpox, Saha Bhojana, sharing food, vehicle borne, Shayasana, Saha Shayya, Asana, Vastra, sharing bed, chair, and dress, format, bond, ornaments, Mali and ornaments, and Lobana sharing. So, utmost care should be taken while consulting a skin patient. As a doctor, you can touch every patient, no problem, over their shoulders as a showing an empathy to them. But for a skin case, don't touch. It can be transmitted to you also. That's the main concern, the main message that I want to convey to you. Okay, the communicability of the skin disease. We are treating skin disease. Again, at last during Grishma Rudu. Okay, there are so many lesions, but I will tell during Grishma Rudu, we are having prickly heat, chickenpox is there, sunstroke is there, suntan is there. This all these are not due to this skin directly skin. It is due to the infections also mainly. And for prickly heat, we can go for the Rakshadi Toyam with sugar, Guluchadi Toyam with Avipati Churna. It is also sugary. Okay, Avipati Churna is indicated. Don't go Rakshadi Toyam, you can add with sugar also. And Dara, Labnum, Velichanna can be given. In chickenpox also, you can go Chadi Kashaya. Haripna, Sudarshana, Gobi, Chandanadi, all those things. After 3 days, Lakshadi can be given. Bathing in Nimbapatra Toya. And after the lesions are gone, Lebana of Eladi Chuna with coconut milk or Bleminor, one cream is there from Himalaya. It is very good. Okay. And Dhara, Vikshirabala, Kumari, Shadadauda, Mahatiktaga, Khadida Pindatela, all these options can be given. And for the Dhara with Thoyam, Nalpamarai, Thoyam, Amalagi, Jalam. And some persons are also just having suntan. For suntan, we can apply Shirabala, okay, Kumari gel, Shadadaudagrita, Mahatiktaga, Malpamradikera, all these can be given. So, what is the importance of this Rudukrama or Rudu in Chikitsa? Anyone? Shidapita, it is due to Shida Marida Samsparsha. The best treatment is Rajanyadi Churna or Haridraganda. We can give Rajanyadi Churna or Haridraganda for a Shidapita patient and Guluchadi Kashaya is enough. Udarda, it is somewhat Kabadigam. You want to strictly concentrate on the diet and lifestyle of that patient. Anyone, what is the importance of this? What is the difference? And what is the importance of Rudu and Chikitsa? Whether Rudu is having an importance in Chikitsa? Whether more skin diseases are more in Grishma Rudu or Sharat Rudu or Shishira Rudu? I think on the chat box, everyone is telling that it is more in. Okay, I will tell. A Rudu, Shishira Rudukrama means Rudukrama starting with Shishira. You are knowing Shishira, Vasanta, Grishma, Varsha, Sharat, and Hemanda. Pravardadi is another thing. Pravardadi means starting with Pravat. Pravat, Varsha, Sharat, Hemanda, Vasanta, and Grishma. Shishira is not there. Shishira is omitted there. Okay. Shishira and Rudu can be assessed in 3 ways. First one is Masa. You are knowing that Kabal Guna Masa. The second one is through constellation. Okay, that Karkadaga, Sravana, like that. And third one is Masha Rashi Sorubakim. This is from Ashtanga Sangha Soruba. Shishira, the word meaning Shashashta Geshtadi Vikshadi Shobhyasma Shishira. Like a rabbit. Okay. The people tend to stay in their house due to the heavy cold outside. It is called Shishira. Vasanta means Vasandi Atra Madanolsava. Madana means Kamadeva. The Kamadeva is having special having flowers. Okay, that's why flowering season is called Vasanta. Grishma, Grasedi Grishma, which extracts Saumya. Varsha means characterized by rains, and Sharat means Himsa. We are here thrashing the rice. We are harvesting the rice by Himsa. Again, Hemanda Handi Sandaba, which is characterized by reduction of hotness. So Pravid means which is heavy rain. What is the difference? It is mentioned by Dalhana that in Shishiradikrama winds that northern part of river Ganga have extreme cold seasons and presence of hailstone. Gangayam Uttare Deshe Varsha Uttara Deshe Shidasu Bahubhavati means Uttarakhand, Uttar Pradesh, Himachal Pradesh, Delhi, Punjab, Haryana, Jammu Kashmir. All those are having Shishiradi Ritukrama. And those on southern side of River Ganga, they have 4 months of rainy season due to the monsoon. Okay, like Kerala, Karnataka, Maharashtra, Goa, Andhra, Tamil Nadu, Odisha, and Madhya Pradesh. So we want to consider like this. Gangayam Dakshine Deshi Varshasu Bhavavadi. In the southern part of or in South India and middle India, mid part of India, it should be Pravridadi Krama that should be considered. And to the northern side of India, it should be Shishiradi Krama. Why? Because Shishira is absent in Kerala or Karnataka like that. We have only 2 months of Hemanda. Okay. And Pravrid is absent in North India. They have only 2 months of rainy season. So what is the difference? Kashaya preparation in Vasanta, I used to prepare like this. 1 spoon Kashaya chuna with 4 glass of water, 2 glass. This is normal pattern. In Varsha, it is reduced. The reduction quantities are 1.5 glass. Water is less. In Grishma, it is more. 5 glass water reduced to 3 glass. More watery content is needed in Kashaya. In Sharat, it is again reduced. Okay. And what is the difference between Grishma and Sharat? It is very, very important. In Grishma, the climate is Ruksha Ushna. And in Sharat, it is Snigdha Ushna. That's the basic difference. That's why in Ruksha Ushna, it is okay. That's why Ruksha Ushna is both the positive. That's why Pitta is not getting any problem in Grishma. Ruksha Ushna. But Sharat, it is Snigdha Ushna. All the qualities are same of Pitta. That's why it is having Pitta Prakopa. And more skin diseases are more in Grishma. Why? It is due to we are having very less Bella in Grishma. First reason. Second reason is that the infectious skin diseases are more in Grishma. More diseases are seen in Grishma and Varsha Rudu, and basically due to the Alpa Bella of the body, and it is more seen in Grishma. The second most skin disease season having more number of skin diseases is Shishira Rudu due to the extreme dryness of the season. Sharad, it is not so much problematic. So season should be considered taking into consideration before selecting treatment. In which season you are giving the treatment and in which place you are staying. All these should be considered. So the principles of Ayurveda is applicable in all field of science and it is not ancient. It is the outlook of the person that determines the age of the science. Okay. So we should consider that this dosha guna, while prescribing medicine to a patient, we should consider which dosha is predominant, which dravya, the guna of that dravya, the roga, which guna of that roga or the disease is predominant. Okay, and we want to start the practicing this, study one yoga every day. Start one clinical examination, whether it is Canterbury sign or whether it is Glasgow Coma scale. We want to study each clinical examination per day. One disease per day, not a single disease. We want to study like this. If you are studying Dadru, we want to study the sloga, Dadru, the word meaning, the sloga, the modern part, including the type, everything should be studied with the treatment. Make a case sheet like that. Make 100 or 200 or 500 case sheet which is coming to you only. I have a case sheet like that. And stay updated with the current advances in the medicine which is going on. That I am telling psoriasis is related with cardiac mortality. Okay, and you are having four pada. Karma pada is that which is related with your doing, and we are having 25% which should be dedicated for that. As we are physicians, we are doing it. Okay, purely our job related. Samahya pada to the society. As doctors, we are serving our society. No problem. 25% will be okay. Kudma pada 25% for your family, and Atma pada 25% for you. You should consider yourself while treating skin patient. Don't get skin patient from a skin patient. Okay, and as emerging Ayurvedic physicians and doing, and as a current Ayurvedic physicians, if there is something that needs to be done, it should be done. If you dedicate your heart, you will get what you want. And I'm just showing some lesions or some dermatological cases that I am dealing with my own opinion and my own treatment aspects. I think it is okay for you. Thank you. Loka samasta sugino bhavantu. I think the drug aspect we will share in the drug aspect of all the diet and lifestyle aspect is coming on the next session. I think your presentation is okay for you. Please tell your comments. Thank you for giving me this opportunity from Kerala Ayurveda classes. Thank you. I think we will share the PPT in the group.
Thank you, Doctor. Thank you for the highly contented class, and it was a nice presentation. All the delegates were following throughout the class. So we hope that we are planning to conduct our next session on 21st October. As our faculty said, we will be having a session on it will be regarding the diet in different kind of skin diseases. So once again, thanking you, sir. So it was a very nice session, and hope you all enjoyed the sessions. And if you have any doubts regarding the session, you can ask in our participating group, so that we can share with the faculty, and it will keep on updating. So once again, thanking you, sir, and good night, all. Yeah, we will be sharing the PPT in participant group. Thank you. Have a good day. Good night.
Thank you. Thank you.